Thank you, Isabel. The federal COVID-19 public health emergency ends this Thursday. NBC 29's Jacob Phillips talks with the Virginia Department of Health about what will change and what will stay the same.
We're not anticipating impact with access to COVID-19 therapeutics. And that's really great.
Alexis Page with the Virginia Department of Health says people will still have full access to COVID-19 treatment following the end of the public health emergency on May 11th.
It's not until these drugs go commercial, which is set sometime in the fall, where there will be impact or will potentially be impact when patients may have to start paying for some of these drugs.
Page also says pharmacists will still be able to provide vaccines to adults.
Pharmacists will still be able to continue to provide those immunizations, whether that be through a statewide, through a Board of Pharmacy protocol or through the PrEP Act. So the PrEP Act will remain in effect for COVID-19 vaccines and for influenza vaccines for pharmacists.
VDH's goal is to try and keep access to care open as it has been throughout the pandemic.
Major changes with the end of the public health emergency really focuses on ensuring that the providers in the Commonwealth still have the ability to continue to provide the services that they have been providing over the past 3 years.
In Charlottesville, Jacob Phillips, NBC 29 News.